So I will be talking on Tepotinib in patients with MET Exon 14 skipping NSCLC. This is a long-term follow-up of Vision trial, which is a phase 2 non-randomized clinical trial. So Vision study is the largest study for MET Exon 14 skipping NSCLC with more than 300 patients. It was probably the first clinical trial in this subset, and it was line agnostic, where treatment name and previously treated patients were taken. Around 18% patients had brain mets. The reasonably elderly patients were there with median age of more than 70 years. So in this long-term follow-up, they have taken cohort A plus cohort C. Cohort A was primary analysis of 152 patients, and in cohort C they have done confirmatory analysis of 161 patients. So total 313 patients were there. Their advanced or metastatic NSCLC, MET Exon 14 skipping mutation detected by liquid biopsy or tumor biopsy or both. No prior treatment with any MET directed therapy or pathway therapy was done. Less than equal to 2 lines of prior therapy was allowed. So we have two subsets here. After cohort A and cohort C were combined, they have reported based on whether patient was treatment naive or patient was previously treated. 164 patients were treatment naive and 149 patients were previously treated. The primary endpoint was overall response rate, and secondary endpoints were duration of response, overall survival, progression-free survival, and safety. As you can see that median age was 74 years in treatment naive patient, and in previously treated patient it was around 70.8 months. And around 18% patients were baseline if we combine both. This slide is largely to show the importance of doing liquid biopsy or a combined biopsy. You can see that around 33% more patients were eligible in this study because liquid biopsy was done. So it is important to do liquid plus solid, especially in picking up these rarer mutations. Endpoint results with more than 18 months of median follow-up in both the cohort. The overall response rate was 51.4%, which is better than chemotherapy or chemo plus IO in this subset. Disease control rate of 76%, duration of response of 18 months, progression-free survival of 11.2 months, and overall survival of 19.6 months. This is the waterfall plot for treatment naive patient when both the cohorts were combined. Here you can see overall response rate of around 57.3% and disease control rate of 78.7%. In previously treated patient, again overall response rate was 45% and disease control rate of 73.8%. Progression-free survival in combined cohort, we can see that in treatment naive patient it is around 12.6 months, and in previously treated patient it is 11 months. For overall survival, again in treatment naive patient it is 21.3 months, and in previously treated patient it is 19.3 months. So the important efficacy endpoints are significant when you compare it with the chemotherapy or immunotherapy usage in this subset of patients. This being a phase 2 trial, we don't have comparator arm, but we can compare it with our routine usage. One more point which was important to note, that patients who were liquid biopsy positive had inferior response rate, disease control rate, progression-free survival, and overall survival, probably showing that liquid biopsy was positive more in high tumor burden patients than low tumor burden patient. Safety profile, this was reasonably safe drug with more than equal to grade 3 toxicity of around 35%. Permanent discontinuation of drug in around 15% of the patients, and any adverse event of around 92%. Most common toxicities were peripheral edema of around 11.2%, which was more than equal to grade 3, but any grade was around 67.1%. Hypoalbuminemia and increase in creatinine were other important toxicities which we need to look at when we do give Tepotinib. Nausea, diarrhea, and transaminitis were other toxicities which were common in this subset. So important message is that this drug do well in first line and even in previously treated patients. So in later line, so we should try that our patient is exposed to this drug if feasible, at least in first, second, or third line. Liquid biopsy picks additional eligible patient for this subset, so probably liquid plus solid is something which we should look at in patients who can afford such drugs. Safety profile is reasonable. We need to look carefully regarding edema, rising creatinine, and decrease in albumin. It is effective in patients with brain mets, so I've not shown the slide, but around 70-80% response rate was there in patients who had brain mets at baseline. So these are the important messages which we can derive from this study. Thank you.